I was not the kind of man who believed in miracles. For most of my life, I believed in numbers, scans, lab results, and what I could see under bright surgical lights. My name is Michael, and I've been a cardiac surgeon for over 20 years. I've held beating hearts in my hands. I've watched lives slip away despite everything we did. And I've seen people credit God. In my mind, it was simply good medicine. If you had met me a few years ago and asked whether I believed in God, I would have given you a polite smile and said something like, I respect religion, but I trust science. That was my shield. The truth was, I didn't just trust science. I hid behind it to avoid deeper questions about life and death. That changed because of one patient. It was a cold evening in winter. I was about to leave the hospital after a long shift when my pager went off urgently. Car accident, young male, massive chest trauma, probable cardiac injury. They needed me in the operating room immediately. When I walked into the OR, the situation was worse than I expected. The patient was a young man, late 20s, maybe 30. His chest was already prepped. His blood pressure was almost non-existent. The anesthesiologist looked at me with that serious expression I had seen too many times. Massive hemothorax, he said. We're losing him? We opened his chest and I saw the problem clearly. There was a tear near the heart, severe damage, and heavy bleeding. For a while, it was just controlled chaos, clamps, sutures, transfusions, drugs. We managed to get temporary control, but his heart was weak, struggling. We put him on bypass, repaired what we could, and then came the hardest part, trying to get the heart to work again on its own. We tried everything. Medications, pacing, defibrillation. I watched the monitor, hoping for a strong rhythm, and instead got irregular, weak, or nothing at all. Time passed faster than I realized. 10 minutes, 20 minutes, 30 minutes. Every extra minute in this state reduced his chance of meaningful recovery. At around 40 minutes, one of the nurses looked at me and said quietly, Doctor, it's been a long time. In my training and practice, there is a threshold where continuing becomes less about hope and more about denial. I knew we were crossing that line. I looked at the lifeless heart, at the straightening line on the monitor, and I felt that familiar, heavy exhaustion of defeat. I gave a few more instructions, tried one last maneuver, and finally, in a calm, clinical voice, I said, we'll give it 2 more minutes. If there's no change, we'll have to call it. As they continued compressions, I stepped back for a moment and glanced through the small glass window in the OR door. Outside, I could see his family, a middle-aged couple and a young woman, maybe his sister, standing in the hallway. I couldn't hear them, but their body language was obvious. Fear, pain, expectation. One of the nurses came closer and said, His family is Muslim, doctor. They've been praying non-stop since he came in. I remember almost scoffing internally. I thought they always pray. Christians, Muslims, everyone. And still, the heart stops, the brain dies, and we sign the papers. Prayer doesn't change that, but I didn't say anything. I just looked back at the heart, limp and silent in the open chest. Those 2 minutes ended. Nothing changed. The monitor line was almost flat. I checked the time. In my mind, the decision was clear. I prepared to say the words no family ever wants to hear, the words that have left my mouth more times than I care to remember, time of death. I opened my mouth to declare it, and something happened. The nurse who had mentioned they were Muslim stepped closer and said, very softly, Doctor, his mother is just outside. She's begging to have 1 more minute to pray. She says, just 1 more minute, please. I don't know why I agreed. Medically, that extra minute was meaningless. But something in her tone, in the desperation of that request, made me pause. Fine, I said. 1 more minute. She quickly went to the door and signaled to the family. I saw the mother press her hands to the glass, lips moving rapidly. Even through the barrier, I could see the intensity in her eyes. She wasn't bargaining with us. She was speaking to someone else entirely. Inside the OR, the scene didn't change. Open chest, exposed heart, almost flat line. We weren't doing anything new. No new drugs, no new shocks. Just waiting out the final minute. And then, as I stood there watching, the line on the monitor twitched. At first, I thought it was artifact, some random electrical noise, but then it twitched again and again. Tiny blips. A weak, bizarre, slow rhythm. Hold on, I said. Stop compressions for a second. We stopped and I stared at the monitor. The blips continued, weak, irregular, but undeniably there. I looked down at the heart. It gave a faint, sluggish squeeze. Then another, a little stronger. No one spoke. We were all staring as if afraid that saying anything would break the spell. I checked the connections, asked for the leads to be repositioned, made sure no one was touching the table. Everything was normal. No technical error. No machine malfunction. Over the next few minutes, that weak rhythm grew more organized. The heart, that lifeless piece of muscle moments ago, was now genuinely beating. Hesitant at first, then gradually stronger. The blood pressure numbers began to climb. Still low, but real. One of the junior doctors whispered, "How, after this long?" Another nurse muttered, "Subhan Allah," under her breath, an Arabic phrase I had heard before, but never really thought about. Glory be to God. I didn't say anything. Outwardly, I stayed composed, gave instructions, stabilized the patient, and finished closing. Inside, however, something had cracked. There are always rare cases and strange recoveries in medicine. We have phrases for them: spontaneous recovery, unexplained improvement, delayed response. We give them names to protect ourselves from the discomfort of the unknown. But in my heart, I knew that what I had just witnessed did not fit neatly into my tidy worldview. We moved him to the ICU. I expected, at best, a poor neurological outcome. After that long without proper circulation, the brain usually pays the price. Yet, as the hours turned into days, this young man did something that made no sense, medically speaking. He started to wake up. Not just reflex movements, but real responsive awareness. He followed commands. He squeezed hands when asked. In time, he opened his eyes, tracked faces, and tried to speak. Every time I checked on him, I felt the same unsettling question rise in my chest. How? The day he was well enough to have a proper conversation, I went to see him. I told myself it was routine follow-up, but I knew there was another reason I was there. He was sitting up slightly, still weak, connected to monitors and lines, but conscious and lucid. His parents were there, the same mother I had seen praying behind the glass. I greeted them and did the usual doctor talk. How are you feeling? We were very worried. You went through a lot. Then, almost against my own nature, I asked him, "Do you remember anything? From the time you were out? From the surgery? From before you woke up?" He looked at me for a few seconds, as if deciding how honest to be. Then he said, in a quiet but firm voice, "I remember being in a dark place. And I remember my mother's voice. I couldn't see her, but I could hear her making dua, praying. And I remember asking Allah, if you save me, I will change my life. I felt something tighten in my chest." His mother began to cry softly. His father bowed his head in gratitude. The young man continued, "I don't know how long I was there. I just know that I felt like I was being pulled back, like something was sending me back. And then I woke up here. On the surface, I nodded professional acknowledgement. Inside, I was shaken. The timing, the one more minute, the flat line that suddenly came back to life, his experience of his mother's prayer, it all lined up. Too precisely. That was the day I went home and, for the first time in my life, typed a word into my computer that I had never seriously considered. Islam. I didn't tell anyone. I didn't make any promises. I just started reading. Medical papers had always been my world. Now I was reading about Tawheed, the oneness of God, about the Quran, about a prophet named Muhammad. I discovered that Muslims believed in one God, not a vague force, but a living, knowing creator. They believed he gives life and causes death, that doctors, machines, and medicines are just tools, while the real power belongs to him alone. I read verses of the Quran translated into English. One of them struck me deeply. No soul dies except by God's permission, at a time already written. Another said that when a person calls upon him in distress, he hears. I thought about that young man. By all our measures, he should not have survived. By our charts, his brain should have been gone. Yet here he was, talking to me, thanking God for a second chance. I also thought about myself. How many times had I declared someone dead with complete certainty? How many times had I told families, we did everything we could, as if we were the ones who ultimately decided? For years I had acted as if the operating room was my kingdom, and the scalpel was my scepter. Now, for the first time, I began to suspect that I had misunderstood my role. I am not the giver of life. I am not the one in control. I am just a means. Over months, I kept reading, watching lectures, listening to Muslims describe their faith. The more I learned, the more it felt like puzzle pieces falling into place. Islam didn't ask me to reject science. It simply put science in its proper place as a tool, a sign, not a god. The turning point came one evening when I was alone in my office after a long day. The hospital was quiet. I clicked on a video of an elderly Muslim man explaining the testimony of faith in Islam, to bear witness that there is no God worthy of worship except Allah, and that Muhammad is his messenger. He explained that this declaration wasn't just about joining a religion. It was about finally acknowledging the truth that had always been there. Our lives, our skills, our successes, our failures, all of it happens under the will of one who knows and controls everything. I thought of the open chest, the silent heart, the flat line, and the mother's prayer. At some point, I realized I was no longer just curious. I believed it. That night, in the quiet of my office, I closed the door, sat down, and whispered the words I had memorized, first in English, then haltingly in Arabic, that I testify there is no God worthy of worship except Allah, and that Muhammad is his messenger. I didn't see a flash of light, I didn't hear a voice, but I felt something I had never felt in any operating room, no matter how successful the surgery, a deep, settling peace. A weight lifted, a sense that I had finally taken off the mask I'd been wearing my entire life. I am still a doctor. I still scrub in, still open chests, still repair hearts. But now, every time I stand over a patient on the table, I say quietly in my heart, "O Allah, you are the one who heals. Use me as a tool in your hands," and every time I hear a monitor beep steadily after a difficult surgery, I don't just think the procedure went well. I think of that young man, his praying mother, that one extra minute, and I remember that behind every beat there is a will greater than mine, greater than any machine, greater than any human being. The surgeon who didn't believe in miracles now lives with one beating in his memory every single day.